Next, let's meet Dr. Andy Smith of Novant Health Surgical Associates. Well, welcome back to the show, Dr. Smith. What a pleasure.
Thank you, June. It's great to be here.
It is. It's great to have you. So there may be some viewers out there who missed you the last time you were on the show. Sure. So tell me a little bit about your background and your education.
Sure. Briefly, I grew up in Tennessee. I went to the University of Tennessee for medical school,
Yes.
and then I did my surgical training in Wilmington, actually just up the road.
That's right. You're local.
That's right. Yeah, and I've been down here since August of 2017, so almost a year now, and settling in and getting busy quickly. It's been good.
It's been great to have you here. So tell me a little bit about your practice. It's Novant Health Surgical Associates.
That's right. There's 5 of us. I have 4 other partners. We have 4 locations. We are, of course, at the hospital in Bolivia on Highway 17, in Leland, in Southport, and also down in the Carolina Shores area.
So you're kind of spread out through the county.
That's right.
Makes it really convenient for all of our viewers.
It's a big county, so we have to be.
Boy, isn't that the truth?
Yeah.
It's a lot of mileage. Well, today we're hoping to learn more about the new vein procedures that you're performing at Novant Health Surgical Associates. So tell me about the kinds of procedures that you offer.
Sure. The big one that we talk about primarily is what's called radiofrequency ablation.
Okay.
And if you look at veins in general, you have a deep system and a superficial system. The deep system is within the muscles. It carries the majority of the blood out of the leg and back to the heart. And it's one that we don't like to touch. It's very sacred. We stay away from the deep venous system.
Okay.
The superficial venous system is the one that we're interested in with this procedure. It's typically the part of the vein system that causes problems with pain and varicose veins, leg swelling, non-healing venous ulcers in the legs, and things of that sort.
So you can see most of the veins that we're talking about, right?
Sometimes, that's right. Yeah, every patient's a little different, so I try not to pigeonhole certain things. But what we tell folks is if you have some of the following symptoms or a combination, pain in your legs, restless legs at night, cramping, swelling, varicose veins. Those are the big 4 that are signs and symptoms of a potential problem with the superficial venous system.
Okay. And this procedure, the ablation, can you explain that to me a little bit about what that entails?
I can. To give you a little better understanding, the vein's job is to bring blood back from the legs to the heart.
Right.
So it's working against gravity. Okay. And when the blood flow is trying to get back up the leg against gravity, we need some help. So we have these one-way valves that are in our veins, and they let blood go up but not pool back down. Correct. So over time, those valves can malfunction or deteriorate, and they become what we call, the word is incompetent. Okay. So an incompetent valve.
Incompetent veins.
Right, and that description is called venous reflux.
Oh.
And so when people have venous reflux, the pressure increases in the legs as the blood pools in the legs, and it puts outward pressure on those superficial veins. And the branches off of some of these superficial veins can dilate up, and those are what varicose veins come from.
Okay.
Those are obviously problematic for a lot of people.
Yes.
And so what we do is we go in with a catheter in our office, done as an office-based procedure.
Okay, don't have to go to the hospital.
Don't have to go
in your office.
Correct.
Okay.
We go in with a catheter, and we put the catheter within one of these big veins called usually it's the saphenous vein. There's another vein sometimes that we treat, and we'll actually heat the vein up with radio frequency. Oh. And the idea there is to warm the vein to the point that it scars down and closes off. So we want to shut that vein down and redistribute the blood flow into healthier veins that do have competent valves so that you don't have that pooling.
So when you shut that one down, the blood finds its way into other veins.
Exactly. Remember we talked about that other deeper system. You've got that deep system to back you up. So when we shut the superficial veins down, we shunt it back into the deep system.
The body's amazing, isn't it? How it can just sort of figure out a new route.
Absolutely, absolutely.
And so, how about those little veins, like I call them spider veins?
Sure.
Do we do anything with those, or is that?
We can. Sometimes those will actually get better with the procedure that I discussed. Not everybody's a candidate for that procedure. We need to do a little workup, including an ultrasound and a couple other things to make sure that we're doing the right procedure for you. But
mostly they're just ugly.
Right. With the spider veins, there are some cosmetic options for those. Unfortunately, insurances don't always cover
Sure.
some of those, but it is certainly, we can discuss those things and what those options are. Sometimes it involves injections and things like that, sclerotherapy that can help get rid of some of those.
Do they ever hurt? Do spider veins hurt?
They can. They can.
Really?
Yeah, and it kind of just depends. Every patient's different, as I said, so it may depend on what the cause of those spider veins is.
So what's the most common vein complaint coming into your office? What do you see most of?
Mostly swelling and pain.
Yeah.
Yep, most people have a lot of swelling or pain in their legs. If you look at venous disease, it actually is about 10 times more common than arterial disease. We always think of problems with the arteries. The problem with vein disease is it's a lot of times unrecognized. With arterial problems, you have heart attacks, you lose legs, things like that. With veins, it's not a life-threatening issue most of the time, and so people kind of suffer in silence with this.
Let's talk about recovery. Is there a recovery period? Do you shut down for a while, or what do we do?
Great question. If we're talking about the ablation procedure, like I said, it's an office-based procedure. It takes me anywhere from 45 minutes to an hour to do the procedure in the office. What we do is we have you put a compression stocking on, or we wrap your leg with a compression wrap, and you'll wear that for a few days, but you're up on your feet and back to normal activity the next day.
Really? So you can drive and everything the next day?
Absolutely.
Well, that's great. How about the results? Are patients generally happy with the results? And
every patient's different.
Different.
Sure.
I know.
Some results are perfect. Some results are pretty good.
Yeah.
I haven't seen a patient yet that hasn't had
Said,
some
I wished I had them back.
Sure, right. So I think you'll find most people have a significant improvement in their lifestyle and what they can do and in how they feel after this procedure.
Well, it was great having you on the show today. I'm really excited about that new procedure. We want to get that word out there about the new vein procedures.
Wonderful, wonderful. Well,
and they can just call the office and make an appointment?
They can call the office. Like I said, it's not for everybody. A lot of times we have to do a couple things to see if you're a good candidate for it. But we're always a phone call away, and my nurses are very knowledgeable about this, and so a lot of times there may be some questions we can even answer for you over the phone to determine if you need to come in and see us.
Great. Well, thanks again for being here. It was a pleasure to have you.
You're very welcome. Great to be here. Thanks.